Medical experts from across Lexington's healthcare system came together today to mark the end of the COVID public health emergency. That comes more than 3 years after the federal government first made that declaration. WKYT's Jeremy Toms joins us in studio with what those doctors had to say. Jeremy?
Yeah, Victor. Dr. Mark Doherty with Baptist Health says there's been an ongoing shift from COVID being a pandemic to becoming endemic in our society. As the threat of COVID as we once knew it fades away and this emergency officially ends, Doherty and others looked back on how far we have come.
The federal government first declared a public health emergency for COVID-19 on January 31st, 2020. By March, lockdowns had swept across the country and put some of our fellow Kentuckians, like Dr. Jeff Fox, in grave danger.
I had been so depleted on the ventilator, I couldn't move. I was so weak, I couldn't turn over. I couldn't get out of bed. I couldn't do anything.
He spent a month in the hospital, removed from both family and even his nurses, and it seemed people of any background could have met the same fate.
We would see martial arts experts who were in unbelievable physical shape that had no other medical problems and ended up almost dying and stuck on the ventilator for a month at a time.
But as time passed, testing systems were developed, vaccines were distributed, and therapeutic options like Paxlovid and Remdesivir were found. Dr. Doherty says because of that, the emergency functionally ended about a year ago, as hospitals were no longer overwhelmed. Still, these doctors agreed that this emergency was life-altering, as many lost loved ones, others are still recovering, and some of the ways that hospitals operate may be forever changed.
I don't think that we're ever not going to wear masks in our clinics that take care of transplant patients or on our floors that are caring for immune compromised patients, because I think we've recognized the importance of that.
These doctors also warn that COVID is, of course, not gone. So as public reporting goes away and the level of testing continues to lessen, it will be up to those in the healthcare field to monitor their hospitals closely and sound the alarm if COVID levels surge again in the future. But with the resources available to them now, these doctors are confident they can handle it. Victor?